I've been studying stroke for about the last 13 years, the better part of my career. And I got interested in that because I realized this incredible public health problem that we have. There are over 6 million stroke survivors, and 800,000 people a year have a stroke. And so there's a lot of people that are affected. They have long-term disability, and a lot of people's livelihoods are completely gone after having had a stroke. And so I was really interested in the aftermath, and so I got interested in outcomes. And so I've been really focusing on both prevention and outcomes for the better part of my career. We designed the AVAIL registry because we were interested in what the factors are related to whether patients continue on their medications after they've had a stroke or not. So what we found with AVAIL is that 75% of patients were still on the same regimen of medications, which includes blood pressure medicine, cholesterol, and blood thinners, maybe more than just 3 medicines, but that's kind of the average. But they're on that same regimen at 3 months as they were at discharge. So 75% is pretty good, and it's probably the best case scenario. But there's still a lot of factors related to the fact that a quarter of the patients are not taking those medicines. And so what we found is that patients with more severe strokes, with a lower quality of life, and patients who are on a lot of medications at discharge are less likely to be taking the medicines at 3 months. In addition, the patients who have established risk factors like high blood pressure, cholesterol, high cholesterol, and diabetes are much more likely to continue their medicines after a stroke than if they're found at the time of the stroke. So the results of the study have pretty dramatically impacted the way that I talk to my patients. I think it's much more important to directly ask patients if they're taking their medicine, which a lot of doctors don't do, and I didn't before in every case. But I ask them if they're taking their medicine, and if they're not, or if they're concerned about their medicine, then I ask them why, and what are the issues that they have with the medicine. Is it financial? Is it side effects? Is it a matter of just not wanting to take a lot of medicine, which is often the answer that I get, or do they forget? So I try to spend a little more time understanding the patient's perspective on medicine, because I think that until the clinicians know that, we can't really help them until we understand their perspective.